You know that moment when you're staring at a pathology textbook, feeling completely overwhelmed? Well, today we're going to turn that anxiety into confidence. We're breaking down high-yield pathology revision for NEET PG, FMGE, and INICET, specifically how to master the most tested concepts, optimize your study strategy, and boost your exam performance. By the end of this episode, you'll have a clear roadmap to pathology success.
And it's such a crucial topic because pathology isn't just another subject, it's the bridge between basic sciences and clinical medicine. According to recent exam analyses, it consistently makes up about 6 to 8% of questions across these competitive exams. Wait, so we're talking about potentially 15, 20 questions in a typical exam? That could make or break someone's rank, right? Exactly. And you know what's interesting? The latest exam patterns show a clear shift towards integrated clinical scenarios rather than isolated factual recall.
So memorizing lists of features isn't enough anymore?
Not at all. Take cardiovascular pathology, for example. The exams now focus on how different concepts connect, like understanding how early MI diagnosis works through TPTC staining. It's fascinating, actually.
Tell me more about that. What's TPTC staining?
So, TPTC, or triphenyl tetrazolium chloride, is this brilliant diagnostic tool. When you dip heart tissue in it, normal areas turn brick red because they're rich in an enzyme called LDH. But infarcted areas, they stay pale because they've lost that enzyme.
That's actually really clever. It's like a natural highlighter for damaged heart tissue.
Exactly. And this is particularly useful in the first 4 hours after an MI, when gross changes aren't visible yet. But here's what students often miss. You need to understand this alongside other early MI changes.
What kind of changes are we talking about?
Well, the earliest change is actually mitochondrial swelling, visible by electron microscopy within 30 minutes. Then you get wavy fibers and vacuolization visible under light microscopy between 30 minutes to 4 hours.
So it's like a timeline of cellular damage?
Precisely. And this is exactly the kind of integrated understanding exams are testing now. They might give you a clinical scenario and ask about the earliest detectable change, or which diagnostic test would be most appropriate at different time points.
Let's talk about study strategy then. How should students approach this kind of integrated learning?
Based on recent exam analyses, I'd recommend dividing your preparation into 3 phases. The first one, 3 months, should focus on building strong concepts using standard textbooks.
And what resources would you recommend for that initial phase?
Robbins Pathology remains the gold standard for conceptual understanding. But here's a pro tip. Don't try to read it cover to cover. Focus on high-yield chapters like cardiovascular, respiratory, and hematology pathology.
That makes sense. What about the second phase?
The next 2-3 months should be all about practice and testing. You want to be attempting at least 50 MCQs daily and 2 grand tests per week. This is where you start seeing how concepts connect in exam-style questions.
And I imagine this helps identify weak areas too?
Absolutely. And speaking of weak areas, let me share something fascinating about endocarditis. It's a topic students often struggle with because there are multiple types.
Oh yeah? Break it down for us.
So you've got 4 main types, but what's really interesting is how they connect to other conditions. Like, did you know that certain cancers can cause heart valve problems through something called NBTE?
NBTE? What's that about?
Non-bacterial thrombotic endocarditis. It's particularly common in lung and pancreatic adenocarcinomas because these tumors produce mucin, which is thrombogenic, meaning it promotes clot formation on heart valves.
That's wild. I never would have connected pancreatic cancer to heart valve issues.
Right? And this is exactly the kind of connection that modern exam questions love to test. They might give you a case of unexplained valve vegetations and ask you to think about underlying malignancies.
So what's the best way to prepare for these kinds of questions?
Image-based learning is crucial. Recent exam patterns show up to 50% of questions are now image-based. You need to be comfortable with gross specimens, microscopy slides, and radiological images.
Any specific resources for that?
Yes, pathology image banks are invaluable. But here's a tip. Don't just memorize what things look like. Understand why they look that way, like with those heart changes we discussed earlier.
Speaking of memorization, what about all those staining techniques students need to know?
Stains are a high-yield topic. For instance, neutral buffered formalin is your standard for light microscopy, but specific conditions need specific stains, like Pearl's Prussian blue for hemosiderin deposits.
How do you recommend memorizing all these different stains?
Visual mnemonics work really well here. Create mental images connecting the stain to what it shows. Like thinking of Prussian blue military uniforms for iron staining It helps the association stick.
That's actually really helpful. What other memory techniques work well for pathology?
Flowcharts are incredibly effective, especially for disease mechanisms. And here's something many students overlook: creating your own short notes during the initial study phase.
Why is that so important?
Because in the final month before the exam, you won't have time to go back to textbooks. You need concise, high-yield notes that you can rapidly review.
Let's talk about common mistakes. What should students avoid?
The biggest mistake is starting practice questions too late. Many students spend too long in the reading phase and don't leave enough time for practice and revision.
When should they ideally start practicing questions?
After covering each major system, start doing topic-specific MCQs. Don't wait until you finish the entire syllabus. This helps reinforce concepts as you learn them.
And what about time management during the actual exam?
Time management is crucial. In these exams, you typically have less than 90 seconds per question. Practice solving MCQs with a timer to build speed without compromising accuracy.
Any specific strategies for approaching MCQs?
Yes, always read the last line of the question first. It tells you what they're actually asking. Then quickly scan the clinical scenario for key information. Don't get bogged down in unnecessary details.
That's really practical advice. What about revision in the final weeks?
The final weeks should focus on high-yield topics and rapid revision. Review your notes, focus on frequently tested concepts, and keep doing practice questions.
And what are those most frequently tested concepts?
Based on recent exam patterns, neoplasia, inflammation, cardiovascular pathology, and hematological disorders are consistently high yield. Also, anything with clear clinical correlations.
How should students approach these topics?
Focus on understanding disease mechanisms rather than just memorizing features. For example, don't just know what amyloidosis looks like. Understand why it occurs and how it affects different organs.
That makes a lot of sense. Any final tips for our listeners?
Yes, maintain an error log while practicing questions. When you get something wrong, note it down and review those topics regularly. It's amazing how often similar concepts come up in the actual exam.
And what about the day before the exam?
Stick to reviewing your short notes and high-yield points. Don't try to learn anything new. And most importantly, get enough rest. A fresh mind makes better decisions during the exam.
This has been incredibly helpful. Any last words for students feeling overwhelmed?
Remember that pathology isn't just about memorizing facts, it's about understanding how diseases work. Once you grasp the basic mechanisms, everything else starts falling into place.
So when you step back from all this, what's the key to success in pathology?
It's about building connections between basic sciences and clinical medicine, between different disease processes, between what you see in images and what's happening at the cellular level.
And that's really what makes pathology fascinating, isn't it? It's not just about identifying diseases, it's about understanding the story of how they develop.
Exactly. And once you start seeing these connections, pathology transforms from a mountain of facts into a logical framework for understanding disease.
Well, that brings us to the end of today's episode of Co-Pilot Podcasts. Remember, just like that TPTC stain reveals hidden heart damage, the right study strategy can reveal the underlying logic of pathology. Thanks for listening.